Anybody that's on the Republican side of the House is not going to um, hear some of these arguments and care about it. So many will. I think many will. I had the pleasure actually of talking with Senator Murkowski when I was in Washington, D.C., and she has been a real supporter of the ACA. We gave the ACAP gave her an award. That's how I had the opportunity to speak with her, relating to some of her past support for Medicaid policy and coverage for children in particular, around continuous coverage. And she was very sympathetic and said all the right things in terms of the importance of Medicaid, and particularly in the state of Alaska. She was saying that it would be absolutely devastating if those types of proposed cuts were to come to pass. And I think there are many others that feel that way and have that same concern. I think, at the end of the day, politics is politics, and people do things for a lot of reasons. But you have to make your best case, and it's, you make your best case from an argument perspective. But in addition to that, it is about having, the folks that are most impacted, who are constituents of these political those in power, to put that pressure to bear. And I think that that's a reality that we can continue to hope for. Arguably, any government spending with the current viewpoint is seen as, partisan, but it doesn't have to be. And it's really our attempt to show that it impacts people across the country in a way that is not limited to blue states, and it's not by any means. So, I think there are places that even red states would see the same concerns as those in the blue states. And it really, there are some less partisan issues than others. And as you may recall, during the campaign, there was a lot of talk about not touching Medicare, not touching Social Security. There wasn't talk about Medicaid because there was I think that was seen as something that we don't want to open up that can of worms. There really wasn't a lot of talk about the ACA. If you recall, during the debate, President Trump said that he helped strengthen the ACA, right? Because politically, it's not popular right now to take it apart or to repeal it. So I think it's really recognizing that, and the public needs to be aware of what's in danger, and there has to be, again, political pressure from every side to avoid an outcome that people really don't want. The voters don't want this. This is something that no voter, I should say no, but this is overwhelmingly supported by voters, to not reduce federal spending on healthcare. I think that simple statement is a fair one to make, that government should not reduce spending on healthcare overall.